Hey everybody, I'm your four-eyed professor, Chris Levens, and I'm super excited to talk to you today. Our roll call is for new and experienced ODs, optometry students, and even those just interested in this profession. We'll cover a number of topics together, and I'll help you see them through a professor's eyes. Please take your seats. School's in session. Welcome back to the podcast, everybody. Thank you for joining. If you listened to a number of the episodes over the years, you probably would gauge that I really enjoy revisiting material that we've talked about before, but I'm even more excited when we talk about topics that we haven't touched on before, and even more exciting than that, touching on topics that I couldn't even predicted when we started this casting that we would even hit on. So I'm going to welcome to the stage Dr. Dennis Pardo. Hi, Dennis. Happy New Year.
Oh, Happy New Year to you, Dr. Levens. It's an absolute pleasure to be here. I'm a big fan of your podcast and so honored to be on one of them.
I love it. So we're talking about a topic that is relevant to, as we'll see, optometry and eye care and patient care, but really relevant to everyday life. And fortunately today, unlike a few decades ago, it's something that's more frequently discussed today, more so than ever, and that's mental health. And it's something that a lot of people, patients and providers, have to deal with in both the lives of themselves and the lives of their patients. Would you agree with that?
Oh, I couldn't agree with that more. This is a topic that I'm very, very passionate about for the reasons that you mentioned. Providers, optometrists, and providers of all stripes are hungry for this information because we don't get enough psychology education and how mental health issues affect our daily practice.
Yeah, you're right. In fact, I don't ever remember being trained on it to any extent whatsoever. And if I was, it's been erased from my frontal lobe, and Lord only knows where it resides now. So before we dive into this, would you tell the audience a bit about yourself? Because I know You've done a number of things in your career.
Yeah, my career has been everything but a straight line. And you know what? I'm blessed. I wouldn't have had it any other way. And so first and foremost, I'm a very proud OD, graduated from the New England College of Optometry and loved the place so much. I stood on to do my residency in family practice and ocular disease, and then stayed on as faculty, primarily supervising fourth-year interns in an externship site that I also worked at and saw my own patients. Prior to that, I have a master's degree in public health from Yale University. So this is about combining my love of optometry, public health, and mental health, the three main careers in my life. Sure. And had 20 years of optometric experience in clinical practice, teaching, did a lot of CE lectures, mostly on ocular disease topics, sure. And now lots of CE on the intersection of mental health and optometry. Then, lo and behold, my last couple of years were in medical affairs. I was traveling 75% of the time and loved it, but retired from that. And always had an inner therapist. So I went back to school, got my MSW at Smith College in Northampton, Massachusetts, with an emphasis on psychodynamic psychotherapy. And now I'm a licensed psychotherapist. So I have two sides of the clinical coin, eye care and mental health. And I love to bring them together.
I love it too. You know, it's one thing that you and I share, a career that was not a straight line. And for the most part, life is not a straight line. It has its twists and turns and unexpected paths, and sometimes it can be really fruitful, even when it's unexpected. So let's take that as the jumping off point, because you said it, and I heard you, that there's an intersection of mental health and optometry, and is this relevant? Is this important? And why?
Why? That's the question. So why is this so important? You know, in addition to the fact that most ODs I speak with, and most MDs and dentists and nurses and PAs, you name it, we don't get the psychology education that we need to practice with our respective profession. And so we're the PCPs for the eye. And so we are often the people that are discovering diabetes for the first time, right?
Sure.
So I also believe, and I'll hopefully with this discussion, that'll come through very strongly, that we also may be the first practitioners to see mental health issues in our practice. And we'll talk about how mental health issues affect eye care and how eye care can affect mental health issues. And so I think that's one of the most important reasons. Another is that mental health is a public health crisis. And if nothing else really brought that to the forefront, it was the pandemic.
Mm-hmm.
And if you could say that anything good came out of the pandemic, because it was horrific, is the attention on mental health. The World Health Organization estimates that depression and anxiety went up a solid 25% worldwide during the pandemic. So this is front and center. We're part of a healthcare team now. As the primary care physician for the eye, we need to work collaboratively and holistically with other providers, right? So I would argue it's important, just as important of having a vitreoretinal specialist to refer to, a cataract surgeon, have one or two mental health professionals in your community that you can refer patients to. And build a rapport with them, as we do with the many other providers that we need to work with. Another reason why this is important is more and more of our patients are taking psychotropic medications.
Right.
I'm sure you see this on intake forms all the time. And so we need to be aware, while rare, there are some ocular side effects of psychotropic medications that are important for us to know. We're also mandated reporters, just like all other healthcare providers. And so if we suspect abuse and neglect, there are mental health issues there, not only for the patient, but for us in having to report. I've only had to do that once in my career as an optometrist, and I can tell you it was really one of the toughest things I ever had to do. Serving our community. This is an opportunity to provide resources for sight debilitating and disabling conditions, like support groups for RP, glaucoma, Sjogren's, keratoconus, because these conditions cause anxiety and depression and sometimes suicidal ideology.
Wow.
So it's very, very important. And then coping with our own stress as ODs. The last time I checked, we're not immune from this, just because I'm human, you're human, and we are subject to the same stressors that everybody else is. And so I think it's important for us to recognize the importance of mental health in our practices, for our employees, as well as for ourselves as practitioners. And then lastly, the most exciting forefront, and with the very beginning of it, is that there are some really interesting beginning research on eye movements, saccades, being able to predict mental health conditions with great accuracy. Some peer-reviewed research with schizophrenia, ADHD, and Alzheimer's disease that could be very exciting in our role in the future in early detection of mental health.
Boy, you're not kidding. I mean, that would blow up the importance of what we do each and every day by hopefully not only be able to early identify, but then early intervene if we have some interventions that are effective.
Absolutely. And make the appropriate referrals to the appropriate mental health professional.
No doubt. So, my mind is just going a ton of different directions, as you might imagine, since this is a topic that I've just never discussed before. So as a provider, one of the things that occurs to me is I come from a generation in which we never talked about mental health issues. Those things were hidden or secretive, or it was a sign of weakness. Now, the more recent generations, like, I have adult children, and they talk about this all the time. And so it's a huge benefit for them to be more open than what my peers would have been and I would have been. Might we still see patients today in a eye care practice where maybe the patient doesn't see the importance of divulging their complete medical list, or some things that they maybe feel a bit insecure about, and maybe not tell me that they're on certain things?
Great question. And I think you hit a very important point. There are generational differences and even ethnicity differences, how we grow up in different cultures that, as you know, is so important to understand the whole patient and the background they may be coming from. You're right that, people in earlier, younger generations are much more willing to be open and honest about mental health issues. But we still have boomers like me that were raised in the time when, we didn't talk about that stuff.
Right.
And so, I think the most important thing, how do we, what are the major mental health conditions that we'll find in our exam chair? And really where it starts is with the intake, right? And so having a separate section on the intake form for mental health issues and for separate from medications, psychotropic medications, can really help people to say, my optometrist is asking me about this proactively. That can really help people to feel more comfortable to disclose.
I love it because to me, right out of the gate, if it's separate, it's more intentional. It's just not, give me this laundry list of stuff, and this is just one item in this random assortment of body conditions. It's purposeful, separate, and intentional, and we maybe get some patients to be more open there.
Yes, it almost gives them a permission.
Yeah.
Say, so I really recommend that. I lecture extensively, on this topic because there is a real interest. And this is a point that, ODs come up to me after and say, oh my gosh, I'm going to do that. I don't have that now. And I love that because we need to make it as easy as possible for our patients to feel comfortable to disclose their mental health issues.
So you're obviously incredibly knowledgeable about this, and I think the audience can tell that in the first 10 minutes of our interaction. Did you know this material or a bulk of it before you went to Smith and got your training, or did this develop during and then since then?
It's interesting. I continued to lecture while I was a full-time student at Smith in optometry, and I asked an OD friend of mine who runs a CE program that I have lectured in before. And I said, listen, I'm thinking about this germ of this idea. Like, do you think this will fly? And oh my gosh, yes, do it. So I actually started putting this together while I was finishing my degree to become a therapist. And so, so now almost 7 years post that, and I'm full-time now in a solo psychotherapy practice. But I keep my hand in the profession by doing podcasts. I've written several articles. I do a lot of CE. I was blessed, the 2023 Academy, this was the plenary topic. And I was part of that plenary as the optometrist turned therapist. And it was the highlight of my career.
I love it. So you mentioned things that we would typically see in any given optometry day, stuff that we'll see in our chair that could be tomorrow, could be Monday. What types of the more common conditions might we have to interact with?
That's an awesome question because I think it's important for ODs to know, right? You can't be an expert like in everything, right? But here are the top things that really come up. Anxiety and depression, number one and number two, and they go together. One may be more prevalent than the other. Generally, what you're going to see is a diagnosis of generalized anxiety disorder or GAD, major depressive disorder or MDD, phobias, doctor phobias, white coat syndrome causing anxiety and blood pressure to go up. Post-traumatic stress disorder, PTSD, particularly for those of us that are privileged to work in the VA system. This is really important. And there are optometric ramifications for that, which we'll talk about. ADHD, attention deficit and hyperactivity disorder, rampant. Lots of diagnosis, things diagnosed, misdiagnosis, anxiety now being diagnosed as ADHD. Schizophrenia, also something that's very common. Substance-related addictive disorders, obsessive compulsive disorder. think trichotillomania, and
Right.
obviously abuse in children, the elderly, and those with disabilities, where we are mandated to report.
Yeah, that's a big list.
Yeah. Yes.
But
And
incredibly
it's,
common. And I appreciate what you said about anxiety and depression going hand in hand, because that would be very that's something that I would predict we do see almost every single day on a busy clinic day. It's just incredibly common. And I also appreciate what you said about ADHD, that I think at some years ago it was just an easy category to dump patients in, and probably some patients got dumped in there without fine tuning exactly what the actual root cause of the problem was.
yeah. Yes. Yes. And so one of the articles that I've written is actually the cover article in Optometry Times in March of 2021. And the only reason why I say this is that I wrote this as a basic primer for ODs to be able to find the basic information, because again, we can't be a neurologist, we can't be a psychotherapist, we can't be, but we need to know a little bit about a lot of things as anyone that does primary care. And so I put together this primer article that I think is a good thing to read to get up to speed on what the basics that you need to know about mental health and how it intersects with our wonderful profession.
Right. So one of the other things that caught my attention that you mentioned, that's something that we deal with each and every day as part of our patient history and intake, is finding out about patient medications. And so that's just one step. But the next step for us is to be fully versed in what these medications might do to the eyes and the ocular system. And I've not reviewed this in a long time, but it would make sense to me that these medications, based on how they're acting, would have potential impact on pupil size, either dilation or constriction, accommodation. You mentioned eye movements, could be potentially refractive error changes, vision changes, photophobia. And that's the meat, a lot of the meat of our examination, if I'm guessing right.
You're absolutely spot on. And that's why I have a 2-hour COPE lecture on this. And that's why I have a whole section on the ocular side effects of psychotropic medications. The good news is, by and large, there are not a lot of ocular side effects for psychotropic medications. So I want to start with that. But it is incumbent upon us to understand the basics. And I'll tell you, the best resource for that is an article in Review of Optometry called The Mind's Eye: Ocular Complications of Psychotropic Medications. And you can look at that online. It's January 15th, 2016. I recommend anyone listening, this is the best primer for understanding the ocular complications of psychotropic medications. But I'll go over some of the most broad and some of the most common. So we talked about anxiety and depression. Well, kind of the go-to are SSRIs, so selective serotonin reuptake inhibitors, along with SNRIs, which are serotonin norepinephrine reuptake inhibitors. And obviously, these are neurotransmitters in the brain that these medications modulate, right? And so for SSRIs, which are probably the most common that you'll see, some of the common names are Zoloft, Wellbutrin, Celexa, Lexapro, and then Prozac, which really kind of started it all off, right? So these are names that anyone listening is going to see on their intake forms.
Sure.
And with SNRIs, where the bigger names are Effexor and Cymbalta. So the eye side effects are rare for these medications. However, intermittent blurry vision from mydriasis and cycloplegia with the SSRIs and SNRIs due to an anticholinergic effect, and we can see a slight increase in IOP.
Interesting.
So let's say we have someone who's borderline, and then all of a sudden we're noticing the IOP is kind of going off to the edge over the threshold. You want to take that into consideration because many patients are on these medications.
I see a number of patients who are on multiple meds Are these effects additive, or once you have one side effect, you pretty much just have that one side effect?
They can be additive because depending upon the medication, there are different side effects. So, like for instance, if someone's on an antipsychotic, so a first generation, which fortunately is not prescribed as much anymore, but we may see this particularly if we work in a VA, Thorazine. And Thorazine also can blur vision, but it can also cause diplopia, and it can decrease tear production. So again, if we have someone that has, mild, moderate dry eye, does this bring them into severe? So again, there are some nuances here. In addition to these medications can cause pigment changes on the conj, in the cornea, on the retina, on the lens. So that's a big one that, if you pair that with the SSRIs, you can get a synergistic effect. Bipolar medication, lithium by far is one of the largest prescribed. What's interesting about this, because I spent a lot of time with tear osmolarity and dry eye and tear osmolarity in particular, and lithium can lead to an increase in tear osmolarity. So if you measure that, which I recommend that you do, you could see differences in sodium. It's because sodium content goes up.
Sure.
And so it's really interesting. You would never think that. Right?
No, absolutely not.
Yeah. And then ADHD medications are largely stimulants like Ritalin, Concerta, Adderall. These are all names that, Vyvanse that you'll see on your forms, and they cause myokymia. So, right, we have patients who call up, I think there's something serious, doc. I don't know. My eyes pop out of my head. And, how much caffeine are you drinking? Are you getting enough sleep? Are you stressed? Because anxiety can cause myokymia. But a stimulant, just like caffeine, makes sense, right? And completely. I never thought about this stuff until I was able to pull the two worlds together.
So more of a 30,000-foot view, how would you respond to the question, how does mental health impact the practice of optometry?
Yes. And I was fortunate. I did a podcast at the Power Hour in 2023 on this topic alone. And so I looked at it from a couple of different perspectives. If we go to the Harvard Business Review, you can now Google, if you go to Harvard Business Review in the search bar and you Google mental health, you will see a lot more articles since the pandemic about how mental health affects business, right? And basically paying attention to mental health is good for business. That's the overall message that you'll see. And there's a particularly good article. It's called, It's a New Era for Mental Health at Work. And that's Harvard Business Review, October 4th, 2021. And so it's a really good overview article that basically says we need psychological safety in the workplace. And that is employees needing mentally healthy workplaces where they feel comfortable to talk about, okay, you know what, I'm having a really bad day. I've got something going on in my family. And what that does is it helps to decrease attrition, decrease absenteeism, and increase productivity, and also increase the ability to connect with patients. And that's not only for ODs, that's for opticians, for para-optometrics, anyone in the practice, the person who's so important at the front desk. If you have an environment that's psychologically safe and that people can say, you know what, I really need to take a mental health day. What I say and what these articles say is that pays itself forward in terms of productivity and the growth of a practice.
That makes perfect sense. It's hard to do, though.
It is.
It can be difficult.
Can be difficult. And you have to worry about confidentiality, right? Because you can't go up to someone's, hey, are you having mental health issues today?
Exactly right.
You can't. You really do have to allow the employee to come to you. And it's the ability to listen. Now, it's not always going to be possible for that person to leave unless it's a mental health crisis, right? We have to run a practice. It's a business, right? But having the openness and an environment where people can say, you know what, if it's possible, I really need to maybe go home a little bit earlier today. You know, that does pay itself forward because that employee appreciates it, feels like they work in an environment where people care, and decreases, like we said, attrition and increases productivity. The other thing is, you know, in staff meetings, you know, bring up, how's everyone doing? You know, not asking about mental health, like, are you depressed? But just like, how's everyone doing? You know, sometimes we jump into staff meetings and we're limited with time. And it's like, you know what, we got to get to these agendas. Start off with, you know, how's everyone doing? How are your holidays? Happy New Year. You know, it's small things like that.
Right.
You know, having information for patients about support groups is also available to your employees. You know, having one or two mental health professionals that you have a relationship with that you refer to your patients can be made available so that your employees can self-refer to
So
them.
do you have a recommendation on how we would seek that out?
You know, just the way you establish relationships with your cataract surgeon and your retinal specialist, you know, set up a coffee, set up a lunch, you know, and the beautiful thing about that is that it's the right thing to do, but you will be surprised in the two-way referrals. You refer someone to a mental health provider, they will thank you by referring patients back to you.
Yeah, I believe that to be true. You know, flashing back to one of the topics we talked about earlier and how, you know, generationally and demographically, this is a topic that wasn't always frequently discussed. Now that it's more open and on the table, I think most of us understand that maybe at one time we thought, well, geez, I don't know anybody who suffers from mental health. Well, actually, it's probably in your household. It's in your extended family. It's in your friend network, and it's in your office staff. It's everywhere. It's pervasive. If we could just pull back the curtain and, like you said, have a safe environment where people can be open, it could lead to greater productivity by being open and receptive.
Yes, absolutely. And, you know, and that's why Harvard Business Review is focusing, you know, which comes out of Harvard Business School, focusing on, you know, that, wait a second. So what you see now are Fortune 100 companies paying for mindfulness apps.
Yeah, you're right. Absolutely. Well, even insurance is paying for those.
Yes, insurance is paying for those. You know, they're offering, they're having people like me who have worked in the corporate environment as well as in the clinical environment come in and do workshops about stress management, about, you know, how to increase productivity by paying attention to things like self-care and being able to express any mental health issues that you have with a therapist.
Yeah. Now, from a practice owner or manager perspective, we have to have our employees there. I get that, but the common sense the common sense here is, to me, is that if we say, nope, I need everybody showing up on Monday at 8 a.m., if somebody is really suffering, they're not going to be productive. And they could lead that disruption in productivity to their compatriots.
Yes.
And so when you take a step back again from 30,000 feet, it all makes sense. It's just at the moment, it sometimes is hard to make sense of it and make decisions, you know, on a whim. I think when you step back and you plan for it, I think we can react to it better. And in the end, it's going to be positive for everybody.
Yes. Yes. And I think the way to approach that is that, listen, you know, we're here to work. This is a practice. This is a business. We have a responsibility to our patients. But the biggest aspect is that if it's a real bona fide mental health need to maybe leave early, you set that at the expectation that people understand this is not just a whim. This is like, listen, we're making a contract with each other. If there's something really, I want to know about it, and I'm going to back you up because this is a psychologically safe work environment. I think if you build that rapport with your employees on every other aspect of the business, you will get that back, that the person's going to say, listen, I'm fine, I'll make it through the day. Or, you know what, I really do need to do this. Because guess what? They're not going to be able to interact with the patients in the way they need to. And that's going to affect things in a different way. Right.
Got it.
Yeah.
So you mentioned, which I believe and understand, that we, the providers, are not immune from mental health issues. So is this something that's pervasive amongst professionals?
Yes, it is. And it's interesting. At the plenary, I was one of 3 speakers, and one of my fellow speakers did a survey. She's the chief wellness officer at The Ohio State University.
Oh, okay.
And she did her section was on a survey of different health professions and stress, anxiety, and depression levels. And overall, medical providers are not doing very well with mental health issues. What's great is optometry is doing better than just about any other. If you look at MDs, both specialists and PCPs, nurses, PAs, dentists have
I know that.
Yeah, a lot of mental health issues among those of us that work in the healthcare field. So even though optometry fares pretty well, the AOA did a survey about burnout, and 60% of physicians, so it wasn't just ODs, it was ODs and other doctoral level health professionals, feel their work schedule hinders time with family and personal time, compared to only 40% of the general population. 44% of physicians report feeling burnt out versus only 28% in the general population. That's a big difference. So even though we fare a little bit better among our medical peers, we still can experience mental health issues. We're human. And, just like the point you raised, the pandemic lowered the stigma of talking about mental health. And so even as ODs, I always tell people, if you need the help, seek it. It's there.
Yeah. And probably very much mirrored to the topic we just discussed. If we can take care of ourselves, we're only going to be better for the patients and better for the practice.
Yes, absolutely. Absolutely. And that's why I say it pays itself forward. Just like self-care, I tell my patients, self-care seems like this amorphous thing. No, it's exercise, it's eating right, it's meditating, it's yoga, there are certain interventions that comprise self-care. And so, it's just as important for us as ODs to have self-care and have a separation from work so that we can be there 100% for our patients and for our staff.
Yeah. Well, as we begin to wrap up, are there any real situations that you can share that have been impactful in your career with real people?
Yes. So I usually try to, let's make this real, right?
Yeah.
I think all of this information is relevant and makes sense, right? But where the rubber hits the road is, where did I encounter this in my clinical experience, both as an optometrist and the reverse as a mental health professional? So when I was in practice, I had a 22-year-old guy who came to me with a history of a phobia of dilation. And I'd never heard of this.
Never heard, me neither.
Never, right? And I never saw it again after that. And, he really wanted to be dilated. I dilate all of my patients, but of course I had to deal with this, right? So we talked about it, and I asked him what it was. And he said, I don't know. It's just every time I've done this, I've, passed out. And so I said, okay, do you want to give it a try this time? I said, let's do some grounded breathing exercises together. I said, you're in control. I'm going to start with 1 drop, and we're going to see how you feel after the 1 drop. And then we'll do some more grounded breathing exercises. Did the first drop. He started to say, oh, yep, I'm feeling faint. Had him just lean his head between his legs. And I said, you and I'm right here with you. We're going to breathe together, feel grounded in the chair. And he was able to get out of it. And I said, are you okay to do the second drop? I'm a little nervous. Okay, we're going to do the same exact thing. So we did that, almost fainted again, but it wasn't as bad as the first time, did the same thing. We were able to dilate, and he came back year after year, and we had much less and less of an issue about it. And, that involved mindfulness, being in the present moment, just grounded breathing, feeling safe, knowing that I was right there, that I wasn't going to push him beyond his limits. And we were able to dilate. And so,
Wow.
yeah, real story.
Yeah, because typically, Dennis, this we'll tell one of our staff members, "Hey, put the drops in room A," and
Right.
we leave, and nobody's there. It's not a safe environment at all. The
Right.
patient doesn't even know the staff member.
Yes.
And I couldn't even fathom that phobia even existed.
Yes. No, 99.9% of our patients, we can do that. They're going to be just fine. Right. But
Right.
people have specific medical phobias. And this was very specific to optometry and a particular procedure. I had another case. This is a really important one, particularly for those who work in the VA system. I had a 60-year-old veteran, and he had been in active duty. And Goldman tonometry, as we're coming closer, he had a startle response. Same thing with BIO, bright lights, with veterans that have a diagnosis of PTSD. So if you see that someone has a diagnosis of PTSD, there are ways in which you can explain what's going to happen, maybe a little bit more than you would, and take it a little bit more slowly and say, listen, you're in control. If you need me to stop, that's fine. Yes, it's going to take a little bit of time, but the startle response is the person's just completely out of the slit lamp.
Right. And dangerous if they come back forward.
And dangerous if they come back forward. Exactly. So that's an example I really love to talk about, because I think that happens a lot. You don't even have to work in a VA, because we have veterans and other patients without military service who have PTSD.
Yep, absolutely.
As a therapist, I worked at Harvard University's counseling center, and had a student who wrote in the intake, I have this eye condition. You probably won't know about it. It's called keratoconus. And it wasn't spelled properly, right? It was pretty close. I was impressed. And as soon as I came in, I was like, I want to talk to you about keratoconus. I said, I do know what it is. I said, in my prior life, I was an optometrist. I said, this patient went from doctor to doctor to doctor with no answers, and became so depressed that they had suicidal ideation. Yeah. And so I think that one is a really, that it really tugs at my heart, because what happened was referral was made for corneal cross-linking, and very, very successful case. And this patient's depression and anxiety decreased tremendously, because they had an answer and they had a treatment that worked, and they felt believed.
Wow.
What was causing their depression is they thought they were crazy, because the doctors couldn't figure out what was going on.
Man, you saved a life there.
And we have the opportunity as ODs to do that, just like we save lives with people if we catch the diabetes early, or we do a visual field and there's a serious tumor that's involved. This is the same thing. And that's why I think it's so important for this information, and why I'm so grateful you allowed me to come on to your podcast to talk.
No, I love it. You've given us a number of calls to action that we can begin to implement right away, change our practice, change our lives, change our staff, change our families, and change our patients, all for the better. That's a win across the board on all scales.
Wow. Well, thank you so much for those kind words. And again, I'm just so honored to be a part of one of your podcasts.
I love it.
I watch all of them. They're very,
I will undoubtedly invite you back, and we'll pick a different renewed topic to talk about. You've been a great guest, Dennis. And thank you for sharing your expertise as well as your personal time with everybody. And thanks to the audience members attending to what I think is a really impactful cast today.
Terrific. Thank you so much, Dr. Levens, and Happy New Year to you.
Bye-bye. Class is ended for today, and we have no exams or grades approaching. Please email me at foureyeedprofessor@gmail.com if there are topics that you would like to hear and see through a professor's eyes.